So in pregnancy, people are usually pretty interested in getting the vulvar varicosities addressed. And so they're common during pregnancy because you got, about half as much more blood than you have when you're not pregnant. So you have this increased blood volume. You have the progesterone decreasing the vessel tone. So that leads to more stasis. And of course, you got a baby on board. And so that uterus itself is right in the area where everything is supposed to be draining. And so if you had some, issue prior to pregnancy that was related to some kind of fascial constraint in that area, it's just going to be more pronounced during pregnancy. And so I like to use the Arvigo myoabdominal therapy to work with the uterus, mobilizing the uterus. I give exercises for strengthening the core so that we can have more stability of the uterus and more lift out of the pelvis. Sometimes people are too busy or they're too far along or, whatever, they're not interested in doing the exercises, not able to for some reason. And so for those folks, we'll do some kind of a belly band or some kind of a faja or a lift and of that belly off of the pelvis so that we can get better drainage. And so I'll do, this visceral and vascular manipulation of the belly and the pelvis. And then after 36 weeks, I'll do the intrapelvic work if the woman is, interested in that. For me, it's super, super important as a retired midwife because I observed sometimes that some of the difficulty in labor was actually caused by fluid retention in the pelvis. And so for me, if you can drain that pelvis and work on the fascial system, not only the fascial system, first you got to work on the fluid, the edema in there, get that all draining out. Then you can see what's going on with the muscles and the fascia and balance that out so that it sets people up for a more straightforward birth. And that's of course my commitment to women and birth. Um, trying to take care of as many things in advance so that the actual experience of labor and birth are as straightforward as they can be. This is Dr. Caroline Peterson from Sarasota, Florida, and Natural Women's Health Institute. Take a look at our website and come in today.